The water crisis began when the city of Flint, Michigan decided to construct a pipeline that would bring water in directly from Lake Huron to cut costs and use the Flint River in the meantime. This was to last 2 years. Because those pipelines hadn't been used in decades, citizens were concerned about the water quality. Despite the city stating it was safe, residents complained about the color and smell, leading to the detection of E. coli. Governor Snyder ordered an increase in chlorine to treat the water, but instead violated the Safe Drinking Water Act due to an increase of total trihalomethane, a toxic byproduct of chlorine interacting with organic matter. Leanne Walters, whose family became ill, contacted Virginia Tech's Dr. Edwards. He studied the lead in the water and found extremely high lead levels of up to 13,000 parts per billion. This prompted the EPA to state that Flint was violating the lead and copper rule, which states water should be treated with orthophosphate, helping control the levels of these elements in the water. This gave rise to a Legionnaire's disease outbreak, which the city claimed it was unrelated. While many high and low-ranking officials have been convicted and a $97 million settlement has been reached, the residents still do not have access to clean water.
Bottom-up grassroots efforts are extremely important in overcoming such a large crisis as this. To tackle such a complicated and multifaceted problem, our group would need to recruit an equally diverse team. This team would consist of a physician, veterinarian, ecologist, chemist, hydrologist, epidemiologist, environmentalist, as well as media and celebrities. Education is the key. We could teach community members ways to quickly check lead content of water and ways to detoxify it, create brochures with lead poisoning symptoms for family members and pets, link up with community organizers to help host monthly cleanups of Flint River, and all work to advocate for better representation at city council meetings. Our group would also like to reach out to media and celebrities to keep reminding the nation that this issue won't go away easily. Celebrities have helped by donating money as well as over 1 million water bottles. However, their greatest contribution might just be their ability to motivate their followers to create enough awareness in order to enact more impactful changes.
For our top-down approach to bring about lasting change, we need money going toward research and medical treatment for Flint. We also need a more transparent system where the flow of information from the public to higher levels of the government cannot be stopped by any one person. We want our new legislation to apply to the whole nation because there are places other than Flint around the country that are experiencing the same problems. We want to provide the EPA with $500 million to be allocated according to proposals from each state's Department of Environmental Quality. The transparency problem in Flint stemmed from the local government, where complaints from the public were not allowed to continue up the chain of command to the state and federal levels. While grassroots social media campaigning is the best way to directly reach the federal government, we will establish a citizen committee that will work closely with state government to relay information directly.
In the case of the Flint water crisis, there were several roadblocks that got in the way of the problem being solved effectively, including, but not limited to, governmental inefficiency and poor communication, limited access to resources such as water sources, and insufficient consultation with different doctrines to devise the best way of solving the problem. Here are some examples of strategies the government could have taken into consideration that would have improved the outcome and timeline of the Flint water crisis.
We need to make sure the public stays informed about what actions are being taken, also to encourage the people to take an active role in their community and self-report if there are any system errors. Our first and foremost concern should be to provide services for people in underserved communities. We can start mobile nutrition services provided by local food banks for those residents without the means to commute. A great idea would be to form an asset map to allocate resources in an effective need-based system. A sustainability plan will help us make sure that everything we worked for continues to provide the public with a safe and healthy environment, as well as the sense of security that their future generations will benefit from.
Created using Powtoon.